It's 4:30 and I call this licensing hearing and public safety committee meeting order. Would you all stand with me and recite the Pledge of Allegiance, please? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice. Okay, we'll call the attendance here. Joe? Here. Razia?
Aye.
Dan? Here. Chairman Zach Russ is on vacation and is excused. Vice Chair Robert LaFave is running the meeting and I'm here. All right. I would like a motion to approve the minutes from our last meeting on March 19th. Or excuse me, March 17th.
Second.
Been moved in second. All those in favor say aye.
Aye.
Chair says aye, that's passed. Okay, for items on discussion, number 6, RO number 123-25 by Fire Chief Montanello pursuant to section 24,400 of the municipal code, submitting the annual report for the fire department for the year of 2024.
Thank you, Chair. So I believe everybody should have received a copy of the annual report.
Yep.
So I'm just going to do a brief,
Maybe because my little.
a brief synopsis or summary of the report. So hopefully everybody can see this. Just some quick points. We hired several. So if you recall, we did increase our staffing through last year's budget by 3. So we hired several new members, and also we had some retirements and replacement. So the first individual here, Chad, he's our very first, when we changed our criteria for hiring. We used to require paramedic, now we don't. So we sent him to school to be trained as a paramedic. So he was our first hire under that new guides. So just some couple hires that we did.
Excuse me, Chief.
Yes.
So now it is mandatory
Or
the other way around.
the other way around. It used to be mandatory to be hired. You need to be a paramedic. Now, the only thing we require is entry level firefighter and then EMR or kind of like a first responder.
And then they have time to get the certification.
Then we send them, yes, if we hire them, we will send them to school.
But the certification is still mandatory.
Correct. Absolutely, yes. Just about everybody on the department now is a firefighter paramedic.
Chief, so before that, they used to get that education on their own. Now the city's paying for it.
Correct.
And I don't understand what the difference is. Why wouldn't we want to have people totally educated before we bring them on? Isn't that an expense of ours?
Absolutely, it is an expense. We had to change to kind of entice applicants. This is a thing that's happening across this nation. Just if you recall last year, we talked about it. There's just not that much interest in both police and fire, but more so fire. We're just not getting the applicant pools. When I started, you get 800 for one spot. You get 500 to 800 applicants. Now you're lucky if you get 10. By doing this last time, if you recall, we just had an application period. We had 30 applicants. We haven't had 30 applicants since I've been here. So it has made a difference, but it does cost. You're absolutely right.
And this individual, if they don't obtain that license, they're not a firefighter.
Correct. Correct. That's part of their probationary.
You know that going in.
Correct.
Okay.
Correct. And we also extended probation. It used to be 12 months. And then I have the option to extend it to 18 months if needed. But now it's a minimum 2 years because of school. It's about a year of schooling.
It's going.
So we still want them to have that opportunity.
Right.
Yes.
And they can have that course at different, or could be.
Yeah, we send ours to MATC.
Okay.
Just because, I mean, LTC does have it, but if it doesn't meet our hiring schedule,
Okay.
then we send them to whatever class we can get. Yes. We did a couple promotions to captain. So this filled our vacancy in captain. So this is Joel Johnsrud to Jeff Granke. So they went from lieutenant to captain. Some other highlights. So we talked about the paramedic and Chad. So I kind of got ahead of myself, and we currently have 3 students now in paramedic. They should be done in June. They're doing very well. Another thing that helped, it brought in local members. So now we have a lot more local individuals that we never had before because they don't meet that criteria. We did obviously the powerboat racing, which is again happening this year, as you know. Something we're very proud of. Our members did the American Lung Association stair climb, and they continue. This is like their 5th year in a row where they topped out at #1. So we're very proud of them. A lot of training. Yeah.
This is nationwide.
This
Yeah.
drill.
Yeah.
I know it was in Milwaukee, so I apologize. I don't know if this event is nation, but it Wisconsin. Yes.
Oh, okay.
I don't know about nationwide, but yes,
Okay.
Wisconsin. So we also did a program that I'm very proud of. My wife teaches special education down in Illinois, and so I worked very closely with them down there and brought a program up here. So we worked with this was our first year, 2024, where the Aspire students come in and learn how to do life skills. Like, so they vacuum, they do our windows, wash the rigs. If the guys are training, they'll watch them train. Just learning how to do life skills. So I'm very proud of that program and giving back to the community that way. Our current chaplain, Father Leo, stepped down, basically had some health issues. So we brought in a new chaplain. So this is a picture of Chaplain Julie. So don't ask me to pronounce her. Mavidity Madalena. I apologize to Chaplain Julie for chopping that up, but she's doing real well, meeting our troops. She actually has an EMT background and fire service background from I believe Colorado, and her husband also has that. So she knows what we're about. So that's great. A couple other things here. Some of our call stats. It's hard to see on the slide, but you will have the comparison in this report. Last year was our busiest year, over 7,000 and change in calls. So we continue that slide up. You'll see this is just another breakdown of what our calls were and some of the fire incidents. Again, every property has a value to it. So this is kind of a misleading slide, but we have to track it for the feds. Property loss versus content loss and all that. So we try our best to do that. So get in your book. A lot of school programs. Again, we obviously it depends on the number of students in classes. So 3,000 was a little drop from the previous few years, but that's because the student numbers dropped. So we continue to do that. Our fire inspections, again, over 2,300 of those. We implemented a new software called First Due because the other software went out of business, or got bought up. But we're continuing to use it. It's meeting our standards, and we're getting more data from it. So that was again last year we did our 4th year of our Citizens Fire Academy. I plug this all the time. We'll have another one in the fall, but if you're able to, I encourage anyone to attend to learn what the fire department does. If you can't do all the classes, it's okay. Or if you can't do all the scenarios, it's okay. It's a 7-week program, but it's just eye-opening to our attendees. Also, this just lists a bunch of the community events we've done. We continue to be out in the community for pub ed. And then the next few slides deal with our training. We do have some criteria that we have to meet, some standards we have to meet, benchmarks by the feds and state. So 17,000 hours total for the whole department of training for fire and 2,700 for EMS. And we'll continue to improve and actually do more. So we put a couple of things for our emergency medical services. We put a new ambulance in service, basically our 4th ambulance. We used to have 3 frontline. Then we put our 4th ambulance, and I'll talk a little more about that later. One of the things that we were, with the council support, we were able to get a grant for our life packs, which are the cardiac monitors where you zap or take blood pressure, see the EKG. So that was huge that we were, got that because it was a matching 10% by the department or city. Something that we did in 2024, we never transported what they call LVO patients, which is large vessel occlusion, because that's time is of the essence for that. And it used to be Orange Cross that would do it. So the hospital approached us last year, asked us if we would be willing to do that because we're staffed 24/7. We have a quicker turnaround time. So we did, and we actually received an award, what they call the Brain Pin Award, but because it was the quickest they've ever had. But in full disclosure, our ambulance, we had one ambulance transport that patient to the hospital. They determined that that individual had to go. Well, another ambulance was just clearing the hospital from a previous call, so they took it. So it was coincidental that our ambulances were there at the same time. So that's what made it the quick turnaround. But we do have higher turnaround than Orange Cross, which we're very proud of. And then again, the budget. So we did work on some capital item. You'll see this is a picture of our new Rescue 1862 that we received. Again, we appreciate everyone's support. We did order our new ambulance. Or we received it. That's the one here at Station 1. And then we replaced our trunk here, which is a constant replacement. We replace about 10 sets a year. And something we had to do because of our age of our equipment, we had to replace one of our ambulance cots. But now when we buy those ambulances, you get new cots. That's part of the cost. So this will be a spare. Yes.
Good. Sure. As far as personnel, the salary and the budget for this 2024, what was that in comparison to 2023?
Pretty close. We were, I want to say about 800,000 for operate, 888 or something like that.
Higher.
No, a little lower in 23. This is higher because again, we added staffing. So
Gotcha. Okay.
it changed the number, and this was all predetermined with finance. So it's not like, yeah. And if you recall as well, we had the shared revenue that was
Right.
between fire, police, and public works.
Mhm.
So again, we're working on the Station 3, Station 2, and that training facility complex with police and fire. So that's ongoing. And then really, you asked some great questions, but that's it as a synopsis. The rest, there's more detail in those in the book.
Okay.
When will that new training and facility at the old highway department facility, or when is that scheduled to be complete and
So-
up and running?
So it really, we have no date for that because the next step would be to present to council the architect's report on what each building, Station 3, Station 2, and that training facility, as well as PD's evidence and shooting range. So all those will be in that report, which we're hoping, knock on wood, to get sometime in February. We wanted to wait until after the new council because we knew with the change, it wasn't good. Yeah, we didn't want to rush it. So after that, it depends on what council says. Then we will determine. We're hoping by 26 to break ground, if not earlier. But we'll see.
So you meant, Chair?
Sure, Bob.
Oh, I'm sorry. Yes.
Thank you. You meant that they were ready already in February, but you wait to present to them to the new council, or in next February?
No. So the book,
Not in-
we are done really design Station 3 and Station 2. We just finished designing or, planning, developing the design for the training complex. We were really working with PD on their shooting range and their evidence expansion for their evidence, the storage collection area. So that we have one more meeting, I believe, on that. And then once that's done, then the architect will develop the report to present to council. So we're hoping in May that report will be done.
Okay. Yeah. Yes.
Well, I'm just curious. I know we addressed this in the past, but so in the last 10 years, if I recall correctly, there are about an average of maybe 2,000 calls more. And obviously the population didn't change much, right? So do you explain that? What's going on?
So, good question. We do get asked that quite often is what we notice. There's a couple factors. Aging, aging population. You get more calls with that. As you build these homes and structures, you don't get the fires in them as much. However, you get families now, and there's things that happen with families, right? So kids hurt themselves. The downside to the one is that people know how to play the system. So you'll get our individuals, and we have several that how can I phrase it? They're constant. They call. They know how to play the system. We're their taxi, and just when you dial 911, we cannot ignore it, and it's just really that's it. The population hasn't increased. You're right. We really haven't, but we're just busier because people's lives are busier. They're out more. COVID saw a decrease because people were isolated in homes. Now that people be people again, right? Car accident, people falling. It's just, yeah.
It's not, have you heard nationwide, if, for example, the use of mobile phone nationwide as a trend has increased the number of calls as well?
So yeah, most
More access to phones.
yeah, most PSAPs, which are the dispatch centers, right? Most of them now have the ability to ping cell phones because there are obviously everybody has one just about, and they're using them more often. So it's easier to hit that button or call 911. I hurt my finger. Can somebody help? And we can't say, okay, is it your pinky? Drive yourself to the hospital. We can't do that. Another thing, the fire department is different than PD. We can't stack calls. So we have to respond. So now part of that call volume you saw on there is us getting help. 70% of our calls from last year are multiple calls, as I've explained. So we're relying more on our help from outside because we don't have the ability to handle all the calls because we're busier. It's just natural. You're never going to be able to get away from that. However, if we could start stacking calls, or if we could start saying, okay, it's your pinky, yeah, get yourself to a doctor's office tomorrow. That's not a life-threatening, but we can't until they change laws. It's
So is
unfortunate.
that what you meant for the 7% overlapping that you have in the?
70.
70%
Yeah.
overlapping, yes? That's
Yeah.
what you meant in the.
So overlapping is if ambulance one is out on a call and we get another call within the time that they're out on that call, that's an overlapping incident. So it could be one overlapping. It could be all 5 stations out at the same time on 5 different calls, and then a 6th call comes in and we get help. So it's all over. We don't track which overlapping incidents are what. It's just an overlapping incident because it's occurring at the same time.
Thank you.
Yeah, so I just had a question too about the 70%. That's always been something that's bothered me a little bit. Are there benchmarks like nationally or statewide that kind of help to give us an idea of where we stand relative to other places? Like, is 70% a concern for you from a staffing standpoint? Or do you feel like we're adequately staffed to deal with that?
So thank you for that. No, there is no national standard for that. It is concerning, yes, but we are tracking it. If it was a constant where all 5 stations are gone at the same time, always, we would have had a conversation long ago to say, I'm going to have to ask for an increase in staffing. I cannot continue to ask volunteers to come to the city to help. I do see a trend that it will increase again. I don't know if we'll ever get to a point of 90% of our calls are overlapping. You never know, but you will never get away from overlapping because it's just
You're right.
part
Oh,
of.
for sure.
Yeah.
That makes sense. So do you feel from a staffing standpoint that we're in a good spot right now? Or, I mean, I know you probably always think it'd be nice to have more staff, but I mean, is there kind of a sweet spot where you'd like to be? Or are we there?
So currently we are, I think at this point, our minimum. I could safely say we're at our minimum, meaning we can handle it. But if it continues to increase or the city continues to expand, we won't be able to handle it. When people say, yeah, it would be nice to have staffing, absolutely, because we don't have individuals assigned solely to being a firefighter, meaning I don't have an engine that has a driver, an officer, and then a backseater, which is our firefighter. We have an officer and a driver 99% of the time because that's it. So it puts us at risk for fires, et cetera. However, if we keep expanding, we will have to increase our staff. I don't have a fifth ambulance that I could staff. So if the city goes south, I'll have to put one
Yeah,
because we don't meet the response times and coverage area. And it's just not fire. It'll affect police. It affects DPW, transit. Yeah. But it's a good way to affect, right? You're expanding, things are changing. So that's always a good thing. Excellent questions. Thank you.
Now, do we need a motion to accept that report or anything?
Yeah, I think
Yes.
we do.
Okay, then I'll accept the motion to accept the report.
I'll make that motion.
Second.
Okay, I have a motion and a second. All those in favor say aye.
Aye.
And no. And the chair votes aye. That is accepted. Number 7, resolution number 186-24-25. Resolution authorizing application for the NAMI of Wisconsin CIT and CIP expansion grant.
If you wanted me to speak on that, I can.
Yes, that'd be good.
So NAMI is the National Alliance for Mental Illness, and they're based out of Madison, Wisconsin. They support CIT training throughout the state. And CIT training is crisis intervention team training for law enforcement. And every year we host a course here in Sheboygan, where it's a 40-hour, 5-day course that brings in a ton of resources and educators and specialists that teach the officers about mental illness, and in an effort so that, you know, we can better de-escalate situations for better problem solving with community partners and resolutions that are not incarceration, but better solutions for everyone involved. So the grant funds and supports that.
Would you say that in the last few years, has there been more incidences involved, individuals with mental health problems that needs to be addressed?
I don't really have the numbers on that. I feel like it's always increasing. And that definitely is probably our number one call for service, anecdotally speaking, but it definitely is a training that we value a lot in. And we don't just put it on for the city. We actually teach all of Sheboygan County law enforcement. So
Thank you, Chair. First of all, you're not in uniform, so I don't know your name.
Captain Mike Stelter.
Okay, thank you. I've heard the name. I know that. With this grant, now that it's been approved for this year, does that automatically go and we're going to get that same grant next year? Or is it going to be?
So we don't have a NAMI affiliate in Sheboygan County.
Okay.
So it's never always for sure thing, but I think we've gotten it 3 years in a row now.
Okay.
And we have a pretty good support system from NAMI in Madison of our program.
And you have an individual at the department that writes for these grants, right? Or who does that?
We kind of share the workload. Yes, for this particular grant.
Okay.
One of my team members wrote for the grant.
Gotcha. Okay. All right. Thank you.
Any other questions or comments? All right, then I'll take a motion to authorize the application.
Move to approve.
Second.
If there's a motion and a second, all those in favor?
Aye.
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 All those opposed, chair votes aye. The resolution is passed. Okay, number 8, RO number 125-24-25, by the city clerk submitting various license applications.
So staff recommends granting these temporary change of premises. These are for the John Michael Kohler Art Center. They do this, as I understand it, they do this every year, where they sort of shut down the city block outside the art center, and they have people come out and sell their items of artwork. There's food trucks, there's alcohol at those food trucks. So they're requesting just temporary changes of premises for several dates. June 26th, July 3rd, 10th, 19th, 20th, 24th, 31st, and then August 7th and 14th. They just did this all at once because they're trying to get it done ahead of time. They've already submitted a special event application, which they're working through currently. So staff would just recommend granting this contingent on all of their special event permits and everything getting through. Because we want to make certain that we're not just giving them the alcohol license and then maybe they're not getting permission on absolutely everything else. So we want to make sure everything's all done at once. So once that special event permit goes through and all that paperwork is done, then these will be actually granted.
I make a
Any
motion.
questions or comments?
I'll second the motion.
Okay,
It's been moved and seconded to accept the recommendation.
all those in favor, say aye.
Aye.
Opposed? Chair votes aye. That's passed. That completes our agenda. And the next meeting date will be April 9th, 2025.
And I'll accept the motion to adjourn.
Make a motion to adjourn.
Second.
Been moved and seconded. All those
In favor,
Aye.
Aye.
opposed? Chair votes aye. We are adjourned.